Imagine standing at the pharmacy counter, just as you have done a dozen times before. You hand over your insurance card, ready to pick up the medication that keeps you healthy. But instead of the familiar rhythmic beeping of the system and the pharmacist's casual confirmation, you are met with a look of confusion. The screen is blank. The systems are down. Across the country, thousands of pharmacists are staring at the same dark screens. It isn't just one pharmacy, it is thousands. It isn't just one city, it is an entire nation's healthcare payment infrastructure that has, in a heartbeat, ceased to exist. This was the reality of the Change Healthcare attack in early 2024, a crisis that didn't just disrupt computers, it threatened the physical well-being of millions. To understand the scale of this disaster, you have to understand who Change Healthcare is. If the American healthcare system were a body, Change Healthcare would be the nervous system and the circulatory system combined. It is a massive, behind-the-scenes clearinghouse. Every time a doctor submits a claim, every time a pharmacy checks if your insurance covers a drug, and every time a hospital tries to get paid for a procedure, that data flows through Change Healthcare's digital pipes. It handles billions of transactions annually. For most of us, the name is invisible, a brand buried deep in the fine print of our insurance paperwork. But when that invisible giant falls, the entire apparatus of American medicine grinds to a halt. The attack was orchestrated by a group known as ALPHV, or Black Cat, a notorious ransomware syndicate. And much like the breaches that shook MGM Resorts and Snowflake, the story of how they broke in is as frustrating as it is simple. They didn't need to invent a complex new virus or navigate through a labyrinth of high-tech digital defenses. They didn't need to be geniuses of code. They just needed a single set of credentials. The attackers gained access to a portal within the company's network that, quite shockingly, did not have multi-factor authentication enabled. It was an unlocked door in a fortress. Once inside, they didn't just steal data, they deployed ransomware that paralyzed the entire system. It was the digital equivalent of a massive traffic accident on the country's most vital highway. Everything stopped. Hospitals couldn't process insurance claims, which meant they couldn't get paid. Pharmacies couldn't verify prescriptions, which meant patients were forced to pay out of pocket for life-saving medication, or worse, go without it entirely. The ripple effect was immediate and catastrophic. Small medical practices, which operate on thin margins, suddenly found themselves unable to process payments. They couldn't pay their staff, they couldn't buy medical supplies, and they were staring down the barrel of insolvency. Oncologists were left scrambling to find ways to pay for chemotherapy drugs without the assurance of insurance reimbursement. It was a chaotic, high-stakes scramble that revealed just how fragile our modern, digitized healthcare system actually is. We have built an incredibly efficient system, one that relies on real-time data exchange, but in doing so, we have created a single point of failure that can be exploited with devastating precision. As the days turned into weeks, the true horror of the situation became clear. This wasn't just a technical glitch that could be rebooted, it was a deep-seated infection that required a total system cleanup. Change Healthcare was forced to take its systems offline to contain the spread of the ransomware. It was a scorched earth policy. The company had to choose between being held hostage indefinitely or shutting down the engine of American healthcare to purge the threat. They chose the latter, but the vacuum left behind was filled with confusion, anger, and fear. The most controversial part of this saga was the response. It was reported that United Health Group, the parent company of Change Healthcare, ultimately paid a ransom in the range of $22 million in Bitcoin to the attackers. It was a decision that ignited a firestorm of debate. On one hand, paying the ransom was an attempt to stop the bleeding, to force the attackers to provide a decryption key and, crucially, to prevent the leak of sensitive, private medical data belonging to millions of Americans. On the other hand, it reinforced the business model of cybercrime. Every time a major corporation pays a ransom, it signals to hackers that ransomware is a profitable enterprise, one with a high return on investment and a relatively low risk of consequence. But even after the payment, the recovery was agonizingly slow. Restoring systems of that scale is not like turning a light switch back on. It is a slow, methodical, and incredibly difficult process of verifying code, patching vulnerabilities, and rebuilding trust. For the providers and the patients on the ground, the system is back online memo didn't mean life immediately returned to normal. It meant a long, painful backlog of claims, thousands of hours of administrative labor to reconcile accounts, and a lingering anxiety that this could happen again. The Change Healthcare attack serves as a definitive case study in the dangers of digital consolidation. Over the past decade, we have seen a trend toward mega corporations buying up smaller providers, unifying systems, and creating vast, centralized hubs for data processing. It's efficient, it's profitable, but it's also a massive security liability. When you consolidate everything into one place, you also consolidate the risk. We have built a world where convenience has outpaced security, where the speed of transactions is prioritized over the resilience of the network. This event was a wake-up call that echoed through the halls of government. It forced regulators to look closer at the cybersecurity requirements for healthcare providers. It raised uncomfortable questions about whether we should allow critical infrastructure to rely so heavily on private, centralized entities that are not subjected to the same rigorous oversight as public utilities. It forced every hospital, pharmacy, and medical practice in the country to rethink their own security posture, to look at their own systems, and to ask, if our link to the central clearinghouse goes down tomorrow, do we have a backup? Do we have a way to treat our patients? The tragedy of this attack is that it was entirely preventable. Multi-factor authentication is not a new technology, it is a basic, foundational layer of security. The fact that a system responsible for the lives and finances of millions of people could be brought down by the lack of such a basic security feature is a profound indictment of the industry's priorities. It reveals a culture where fast is preferred to safe, and where security is often treated as an IT problem rather than a core business risk. As we move forward, the lesson of Change Healthcare is that cybersecurity is not just a digital concern, it is a public health issue. Our medical records, our prescriptions, and our insurance payments are part of our bodily autonomy. When they are locked away, the quality of care we receive suffers, and the trust we place in the institutions that heal us is shaken. The neon signs of the pharmacies are back on, the insurance claims are processing again, and the heartbeat of the system has resumed its rhythm. But the scar remains. We have learned that the systems we rely on are not immutable. They are fragile, they are interconnected, and they are protected only by the strength of the security we choose to implement. Ultimately, the hackers didn't defeat the healthcare system with advanced weaponry. They defeated it by exploiting our own complacency. They found the weakest link, a simple, unprotected login, and they pulled on it until the whole structure came undone. The challenge now is to rebuild that trust, not with better firewalls or more expensive software, but with a fundamental change in how we perceive risk. We have to treat every login as a fortress wall and every employee as a frontline defender. Because in the game of cyber warfare, the attackers only have to be right once, but we have to be right every single day. The question isn't whether another attack will come. The question is whether we will be ready for it when it does.